Sterilization and disinfection, the unsung heroes of infection control. Let's start. So first of all, we have to understand what different terminologies mean, like decontamination, cleaning, disinfection, antisepsis, and sterilization. People sometimes use them synonymously or interchangeably, but that's not correct. So let us try and understand to learn each and every term clearly. So first we will start with cleaning. Whenever you say cleaning, that means it is a process by which a visible soil is removed. That means it is removal of organic and inorganic matter which is present on any environmental surface. And it is very essential, or it is kind of prerequisite before any sterilization or disinfection procedure. And it is said that cleaning will achieve 1 or more CFU log reduction in number of pathogens. And cleaning can be done manually, or now we also have automated washers available. So with help of proteolytic enzymes, detergent and soap, we can achieve cleaning. Then second term is germicide. When we say germicide, that means most of the pathogens will be removed from the surfaces. It does not guarantee removal of spores. Spores may be removed, may not be removed, but yes, it will definitely achieve more CFU log reduction compared to cleaning. It will at least achieve 10⁻³ or more CFU log reduction. Now, if this process is done on non-living surfaces, we call it as disinfection. But if it is done on living surfaces, that means on human beings, we call it as antisepsis or antiseptics. Now this disinfectants, we can divide them further into high level disinfectant, intermediate level disinfectant and low level disinfectant. So high level disinfectant includes aldehyde, peracetic acid, hydrogen peroxide, while intermediate level disinfectant procedures like pasteurization, boiling, steaming, as well as some chemicals like alcohol, phenol, chlorine, iodine, quaternary ammonium compound, chlorhexidine, they are included in lower level disinfectant. But whenever we say sterilization, it is meant to be done on mostly non-living surfaces. Here all microbes will be removed, including bacterial spores. So sterilization always guarantees removal of spore, and here 10⁻⁶ or more CFU log reduction is must. And there are various physical as well as chemical procedures which are available which will achieve sterilization, like hot oven, incineration, autoclave, microwave, filtration, ionizing and non-ionizing radiation. There are various new techniques like ethylene oxide and plasma sterilizer. Some HLD or high level disinfectant, if they are used at a high concentration or for a prolonged period of time, they can act as a sterilant, like glutaraldehyde, hydrogen peroxide, peracetic acid are some examples. So we have discussed cleaning, disinfection, antisepsis and sterilization. Now the last one is decontamination. Decontamination is this entire process which removes pathogens from the object so they are safe to handle, use or discard. So I can say decontamination is a very broad term and it involves cleaning as well as disinfection or sterilization. So I hope this is very clear.